Hello, my name's Elizabeth Jancola. I'm an occupational therapist here to talk to you today about belly restoration. So this is a good video for anybody who struggles with any kind of digestive issues or is just interested in learning a little bit more about their anatomy and physiology and how to optimize their digestion. So the first thing we're going to talk about is a little bit of the anatomy and physiology of digestion. Starting in the mouth, when we eat food, there's a common saying that goes, you want to chew your drink. So if you drink a little water, you want to chew it around, mix it with your saliva, start to begin the digestive process there. And then you also want to drink your food. So that means, you take a nice big bite of food and you want to chew and chew and chew and chew and chew until it's almost like a liquid in your mouth. That really does a lot to start to boost the digestive enzymes in your mouth before it goes down into your stomach, helps your body absorb more nutrients and make the most of the energy in the food. That's especially true if you're a vegetarian or a vegan. The next step is going to be it goes down the esophagus into the stomach. Not a lot of people are always aware of where their anatomy is. So typically the stomach and spleen are on the left side of the body around here. I always like to encourage people to start even placing your hands over the different organs in your body. A really important step in healing yourself is learning your anatomy and physiology. So just gonna place the hands over the stomach. The spleen is on the side here. And just breathe into the stomach. It's shaped like a sack. It's typically got a little bit of a convex arc going this way towards the side, comes in and around, and then is a little bit concave on over here. So we're just gonna breathe into that. It starts with your imagination. So just imagining that shape of your stomach in there. So another little piece of our physiology is that there are basically two aspects to the nervous system. We've got the rest and digest aspect of the nervous system and the fight and flight aspect of the nervous system. So one of the ways we can help drop into that rest and digest part of the nervous system is doing simple exercises like this, where you lay your hands over your stomach. Sometimes it's nice to put one over your belly button and your heart, and just take a few deep breaths there. If you really want to deepen the relaxation, you can focus on your exhale. You can also make a little sound on the exhale, like this is just another way that we can work in a dynamic way to support our digestion and our belly restoration. So it's not just about all the functions of the digestive system, it's about optimizing the nervous system, keeping it in that rest and digest state for as much of the day as possible so that the organs can do the job that they're meant to do. So after the food leaves the stomach, it's gonna pass into the small intestine. On its way around the small intestine, it's going to pass by the liver and gallbladder. So the gallbladder is going to release some fluids that are going to help to break down fats. The liver also has over 400 functions to it, some of which also help with digestion as well as cleaning the blood, keeping our immune systems healthy. All of these are little pieces that all go into supporting the overall picture of healthy digestion. So we're going to take a moment with the liver, which is primarily on the right side over here. Though the liver is so big, it actually goes all the way across the chest, nearly to the left side nipple point, and then drops down towards the bottom of the right side rib cage. And we want to think in 3 dimensions here. So you can put one hand, if you're able, around the side of the rib cage to support the back of the liver, one hand across the front right side here to support the front of the liver. And again, just getting to know your anatomy, taking a few breaths here, tuning into your liver. If you like, you can take a moment to smile into your liver, thanking your liver for all the work it does to keep your digestion strong. All right, and so the food has now traveled through the small intestine past the liver place, and then it's going to kind of keep weaving back and forth through kind of like the front part of your belly area. So it goes back and forth until it gets all the way down here to where it meets a junction with the large intestine. So some of you, either yourselves or might know somebody who has had an infection in their appendix. Well, the appendix is kind of right in this area. It dips down right by the iliac crest here of your hip bone that you put your hands on. We want to make sure that things flow nice and healthy there, because there's actually like a little pocket down in here, and the appendix is like a little squiggle that comes down from there, and it also plays an important role in our immune function, and just kind of helps to support the digestive process in general through that immune capacity that it has. And so here we've got the junction with the small intestine and the large intestine. This little pocket here is called the cecum, where the appendix hangs off of. So it's good to take note of these junctures. So we're also just going to hold our hands at this juncture here, using the breath to tune in. And the magical thing that happens when we just use our breath and our hands to tune into a place in the body is that it tends to allow it to naturally relax. So let's take one more breath here at that junction between the small and large intestine. Beautiful. Then we're gonna make our way up the large intestine. It's going to run up to an anchor point. It's got some ligaments up here underneath the rib cage in front of the liver, where it's going to come up and fold over itself before it gets ready to move across the front part of the abdomen. So typically when we're looking at anatomy and physiology books, this structure is drawn straight across underneath the rib cage. In living people, in living specimens that aren't coming from, either anatomy and physiology textbooks or cadavers that have already been sort of treated with formaldehyde and kind of locked into place. In our living bodies, typically the large intestine dips down even as low as the belly button before it comes back up to its anchor point on the left side of the rib cage. And then once it hits there, it's going to fold down behind itself before it makes its final descent down into the area of this, again, we're heading into our hip area, and then it's going to come towards the middle as it starts to go into the sigmoid colon and then the rectum before we have a bowel movement. So really good to be aware of the feeling of the large intestine and the placement of it, because if you're ever dealing with constipation or something like that, you can actually start to support the peristaltic movement, that rhythmic movement of the large intestine, by just giving it some gentle massage and warmth. Sometimes you might like to start, if you can already feel that you have sort of like, you can almost sometimes feel the bowel movement starting to head into the sigmoid colon and the rectum here. So you can give it a little massage there to start to open up that pathway before moving over to the beginning of the large intestine on the right side near the hip. And this technique is actually called cat's paw. So if you've ever had a cat kind of knead your abdomen, you can just kind of take your fingertips. You don't have to press too hard. We're being gentle with ourselves, and you can just use this cat paw motion to feel into all these places. And you can do this lying down as well. feeling into all these places, using your palpation skills to find the pathway of the large intestine. You know, I'm going a little fast because this is video, but in your own time and space, you can really just lay down and take a few breaths as you move through before you move on to the next section of your large intestine. And then, of course, we make our way down into the rectum area. So at this point, you'll be just above your pubic bone, and because your bladder is in front, you'll probably feel more your bladder at this point than the large intestine. But that's just going to be your circuit there to complete your abdominal massage. And then you might like to finish with by making some circles coming up the right side and down the left side. And all the while making sure that you're taking nice deep breaths. So a lot of times we're learning belly breaths. The optimal way to breathe would be the combination of filling the belly and filling the rib cage at the same time. You don't want to just fill up your belly with air. You want sort of that dynamic relationship between the breath going into the abdomen at the same time that it's spreading laterally and filling the lungs. So just go ahead and take a couple breaths like that, filling the belly, opening the lungs, and exhale. And just gathering the energy into your center and into your core so that your body can take care of all the digestive processes that it needs to do to keep your body healthy and in balance. So that's all we're going to talk about today for our belly restoration session. We will have a follow-up video soon with a little bit more detail, but I just wanted to get that information out there so that you have a nice starting place to start working on yourself and tuning into your body. Thanks so much, and I look forward to connecting soon.